seen the strain that it put on families to transfer somebody out, right? I would have people come up and say, I don't have a car to get to X hospital. I don't have money, gas, means to go and visit my family member or be there for my family member an hour or two away. I've experienced that for 15 years as an ER nurse. And it was so needed at the time to figure out how to provide care close to home.
Hey there, I'm your host, Sarah Lorenzini, a rapid response nurse and educator who loves telling stories to teach critical thinking. This podcast is for nurses who want the knowledge, skills, and confidence to respond to any emergency. With almost 20 years of experience in the ER and critical care nursing and a master's degree in nursing education, I have a lot of stories to share, and I love to nerd out and break down the pathophysiology, pharmacology, and nurses' role in emergencies. Stories bring learning to life. It is way easier to learn from and remember the stories that my colleagues and mentors have told me than anything I've read in a textbook. And that is why I made this podcast. Every episode is packed full of exactly what you need to know to handle whatever crisis that could arise on your shift. It's one thing to get the right answer on the test, but knowing how to detect when your patient is declining and what to do when your patient is crashing is what will make or break your day and might just save your patient's life. Today's episode is about both innovation and what I like to call the heart of nursing and healthcare. I'm joined by Kristen. She's an ICU nurse leader who, as you will hear, is passionate about keeping patients close to home and surrounded by family during critical illness. So we'll talk about what it means to lead in a resource-limited environment, some tools that support nurses and their patients in delivering care in these environments, and the ripple effect of caring for patients within their own community. So whether you're a nurse caring for your community at a rural or critical access hospital, or a nurse who gets to work alongside a huge team of resources to deliver care at a larger tertiary care center, this episode is for both of you. So I personally have grown so much as a nurse from listening to and being inspired by the stories from nurses across the globe. And I'm looking forward to sharing Kristen's journey with you. We can learn so much from each other's experiences. So let's dive in. Kristen, welcome to the podcast.
Thank you. Thank you for having me. I'm excited. My first time.
I'm excited to have you. Yes. We have a lot to talk about. Before we dive into the specifics of your hospital and the care you get to provide, you just talk to us about your background in nursing and what led you to the ICU leadership role.
Yes. My name is Kristen RN, and I'm currently a director of critical care and trauma services at a local hospital, a community-based hospital in Northern California. And I've had the privilege of working at this hospital for almost 20 years.
Wow.
Which is crazy because I'm only 27. But my background is actually a blend of, I started on med-surg, and then I drove myself into my passion of emergency medicine and trauma care. And then I was an ER nurse for about 15 years. And I really developed a passion for rural healthcare in the 20 years that I've been at the hospital. And I wanted to see growth and development for my community and my patients and their families. And I also have a passion for education, which sort of led me into leadership and developing with my partners a trauma program at our hospital. And then it sort of shifted into ICU leadership, which is where I've been at for the last couple of years. So that's a little bit about me.
Awesome. So, you didn't go to nursing school wanting to be the ICU leader that you are today?
I did not see that. For a long time, it was like, oh, ER versus ICU. What does it take to be an ER nurse versus an ICU nurse? And I am so happy with my transition and still get to dabble a little bit in the ER when the need is there, but just really loving my role right now.
Awesome. So what would you say you love the most about serving in a smaller community hospital setting?
It's funny, I was thinking about this and preparing for the podcast, and I was looking at my LinkedIn profile, which I set up well over a decade ago. I can't even remember. And on it, it has I am a passionate rural healthcare nurse. It is where I have lived my whole life in rural areas. And I'm so drawn to the patients in my community that I'm just like a self-proclaimed rural nursing champion. I don't
Yes.
know if they're out there, but if there is one of them, I want to be it. I've never worked in a urban or in a metropolitan area, but I have grown to appreciate what rural healthcare means for my hospital.
So I see how much you love, caring for your community in this rural space. But what are some of the challenges you would say maybe that your ICU is facing when caring for critically ill patients, maybe with a limited specialty? What is different? What are the challenges you face?
Yeah, well, in a rural setting, you have limited access to care on the outpatient setting, right? Fewer specialties, fewer providers. We're all sort of facing that across the nation. And it sort of translates into the inpatient setting where if you have fewer resources, fewer specialists on the inpatient setting, you're often having your ERs transferred to tertiary care or academic centers or just a larger hospital. And for us, that can be, as the crow flies, an hour to 2-3 hours away. And that coupled with fewer beds at those hospitals, and everybody's fighting for the tertiary care hospital beds. And then our EMS resources, limited transport, and then also our geographical terrain, if you will, which, we have severe weather. So it's one thing after another, and they could all be a problem at the same time, or individually, they can make it quite difficult to get patients to where they need to go, which is sort of the emphasis and the focus of developing what we can do in our ICU and in our hospital.
I love that. So what I'm hearing from you, and I've heard from nurses across our country, is that it is a joy to work at the rural facility. But sometimes it's so hard because you want to provide the services this patient needs. You don't want to have to send them out. One, because it may be a while so you can send them out because of weather, because of transport, because of the other tertiary care facility can't accept the patient right now. I mean, that's the challenge. But you also don't want to send them out because you want to be able to keep them close to their family, keep them close to home. I mean, if I was recovering from critical illness, I wouldn't want to be 3 hours away from my hometown. I'd want to be close to where my family is so they can come visit me, after they get off work and not have to, make this trek across whatever terrain, whatever weather to go visit. So yes, I hear you. You want to keep these patients close to home. Fortunately, there's actually a lot of technology available now and telemedicine and so many things that allow patients to stay close to home. What are some of the resources that you do offer that are allowing patients to maybe stay in your care?
Yeah, and really rural healthcare, rural medicine, you have to be the innovators, right? You have to figure out how to do, let's just say, healthcare differently. And part of that is incorporating telemedicine. We've been doing that for a long time at our hospital, but nothing is really new there. Of course, it really increased during COVID. So we've become quite proficient at that, which is a huge value add to our community and to our patients. And in addition to that, you really have to look at what other technology can you incorporate into your patient's care, into your patient's journey. And part of that for us is as we build our ICU program here at our hospital, we wanted to sort of figure out what can we do to avoid having to send. So we have a teleneurology. And in addition to that service, my medical director says, Kristen, we should be performing spot EEGs here at the hospital. And we'd never had that technology. And it really just took a little bit of, seeing what was out there, talking to the experts, understanding what other hospitals are doing throughout the country, and of course, networking. And we sort of stumbled upon Zeto EEG services for hospitals just like mine, which then all the fireworks started going off on how can we incorporate this into our ICU, and not just our ICU, our med surge, our tele unit, our ER, and really optimize technology and telehealth services.
That's awesome. So in addition to having maybe a telemedicine provider on camera, you can actually see what's happening inside the patient's brain with this Zeto that you're talking about. So I just kind of want to understand it a little bit more. At my hospital, and we're a pretty big tertiary care center, even for us, when a patient is having a seizure or suspected seizure and we want to do an EEG, it's a whole process. I mean, like you have to call the EEG tech. They're often very busy. They can't come right away. I mean, you're looking at hours sometimes until the EEG happens. So if we have something like Zeto, how does that change things for you as the nurse, but also like for the patient?
Yeah, in rural healthcare, you have to learn how to sort of respond to the technology. So in larger hospitals, you may have EEG techs where, they're just ready to perform these EEGs and they're ready to go. Well, in our hospital, we really had to do it a little bit differently, where we've trained registered nurses and respiratory therapists to respond to the order, say, okay, we need to figure out whether or not this patient is in status or not, figure out what their baseline is, and perform a spot EEG. So either an RT or an RN go and perform the EEG, which is pretty great. Is a headset that you put onto the patient. You have a computer and you hook up the patient and you analyze them for, depending on what the doctor orders, somewhere between 30, 40 up to almost an hour of EEG, a spot EEG. And right there, you can send the tracing or the reading to your team of neurologists, and they can sort of just say, these are our recommendations. This is what we're seeing. And it sort of provides the care team with a plan for what we're going to do with this patient. Are we able to manage this patient here at our hospital, or is it time to transfer them based on what the tracing shows?
Hey guys, this is post-recording Sarah. I just wanted to interject real quick and talk about the reason why sometimes it's challenging to recognize a seizure, and how sometimes as clinicians, we really do have a difficult time parsing out what is a true seizure, like epileptic type activity, versus a metabolic derangement or even something psychiatric in nature. One of the hardest things about seizure assessment is that not all seizures look like the classic tonic-clonic movements we all think of. Many patients experience subclinical seizures, meaning the abnormal electrical activity is happening in the brain, but there's little to no outward physical movement. Like the patient may just look confused, withdrawn, not following commands, maybe having some subtle facial twitching or eye deviation. And especially in the ICU, when patients are intubated and sedated, it's very difficult to recognize a subclinical seizure when it's happening. And that's where point-of-care EEG devices like Zeto become incredibly valuable. With a traditional EEG, you often need a neurotech, lots of equipment, maybe even a transfer to a bigger facility, and that all takes time. But a point-of-care EEG lets you get eyes on the actual electrical activity in the brain right at the bedside within minutes. So in simple terms, point-of-care EEG gives clinicians rapid clarity as to where to go from here, confirms whether a patient's actively seizing or their symptoms are coming from a totally different cause. And it helps hospitals like Kristen's keep patients close to home so they can start the treatment even faster. Okay, back to the episode. Sometimes you don't know if it's a seizure or not. I mean, honestly, I've been watching seizures for 20 plus years and I still sometimes cannot tell. And so it'd be so nice to have that technology just to be able to place on the patient. I want to back up. Did you say your nurses and respiratory therapists are able to place this device? You don't need an EEG trained tech to do it?
No, we don't. And that's actually like, in addition to what we're doing for our patients here, this is professional development for our teams, right? Like there's a huge focus to look at top of practice. How do we engage our teams or our associates or our staff and allow them to grow in their skill set? And this is just like another one of those things where who knew that you could go to a rural hospital, you can become a rural ER, ICU nurse, or an RT, and then all of a sudden you're doing EEGs. It's pretty cool. And the team has responded so well, which is like, of course, like as a nurse leader, you just want to like, ooh, it's great. It's great to see that. So it's an added bonus to the service, which is great.
For sure. I mean, I think about back to whenever I learned how to use an ultrasound to place IVs, and I felt like, oh, ain't nothing going to stop me now. Like, I can help all the patients. I have an ultrasound. I can see the vein. It must be similar once you get training how to use Zeto. Okay, so I place this device on the patient, and now I, as the bedside nurse, can know if they're seizing or not, and I can help guide their clinical course. Like, I don't have to defer that to someone else. I can be a part of making this diagnosis. How empowering is that?
Yeah.
So I'm still so fascinated by this. What was the implementation process like? Like, how was training of the staff? How has buy-in been for the staff? Not just for the nurses, for the physicians, for the respiratory therapists who now get to do this intervention. How has that been for your team? Hey guys, I'll get back to the show in just 1 second. But before I do, I have a request. If you have ever gotten any value from this podcast and you want the show to continue to grow, to access more awesome experts in the field, and to keep providing you with more nursing knowledge and inspiration, could you take a minute to leave a rating and a review? Those reviews on Apple and Spotify go a long way in getting this podcast in the hands of more nurses and bringing new guests to the show. And they just make my day to know that my stories and nerdy patho breakdown are helping other nurses thrive, or at least survive. So if you're feeling up to it, I'd love to see a rating and review from you. Thank you so much. Now back to the show.
Yeah. And that is, again, that's kind of the testament to rural healthcare, is that as leaders, it's important for us to sort of cast the vision, right? So it isn't just performing an EEG, right? The cell is not, you get to do another task. The big picture and like how we've been successful is, hey teams, this is our push and these are our initiatives for keeping patients close to home. And as we developed our ICU program in collaboration with our medical director and our intensivists, they were like, well, an EEG, a spot EEG, is going to be an additional tool that we have to wrap our arms around this altered mental status patients, seizure patients. And in addition to that, we are going to implement our abilities to do MRIs on these patients with MRI safe equipment, vents, pump monitoring systems, right? And so when the team says, oh, look at us, we're growing, we're building, we're doing things, it's a way to empower staff so that they want to do these things to keep these patients. That's really where the success has come from, is that it's a collective collaboration with our teams. And in addition to that, of course, we had to actually do the training, which Zeto, Josue from Zeto, I'll just tell you, okay, this guy's amazing. He came out to our hospital and ran nurses and RTs through this training program and really set the tone for the customer service that comes with Zeto. I'll just say that is the approachability, the availability of, hey, this is new for us. You know, I'm having tech issues or operator error or whatever it is. The support that we've had in working through this and in the training and the competency development has been great. And I think that's a true testament to, well, I'll say Josue from Zeto, but also just Zeto customer service in general.
That's awesome. Okay, so they actually sent someone out to your hospital. You put all the nurses through this training. How long would you say until everyone was like proficient and be able to do this independently?
This technology is very, very easy to use. And I think that also helps with the buy-in, is that it's not complex, it's not cumbersome. And that has made us, I think, a lot more successful.
That's awesome. So I love telling stories on my podcast. I feel like that's a really good way to make concepts kind of come alive and make more sense. Can you think of any like case examples, obviously without patient identifiers, but any examples of how patient came to your hospital, you guys were able to use Zeto, and because of that, keep them close to home, move their care forward without having to ship them out to a tertiary? Can you think of any cases like that?
Yeah, I would say I think it's sort of in broad strokes when you think about prior to having the ability to perform a spot EEG, and you had a patient that had altered mental status that maybe came in by EMS, sort of like a family says maybe seizure, not seizure, we don't know, seizure-like activity, all those things, right? Where you hear the word seizure in the patient presentation. You get them into your ER, you get them into your trauma bay, they're intubated, family's not around. Prior to having this technology, that patient is, we don't know, maybe they are having some sort of a seizure, we don't know, like, we're just going to be safe, we're going to transfer these patients. And so you never really knew whether or not you could have kept them in our ICU, you could have kept them close to home, and you just transfer them out. So now it's a culture shift, right? You have these patients, you have the same story. Your providers are like, well, we have this whole ability to manage altered mental status or seizure patients, seizure, no seizure patients with these tools, including a spot EEG. And we are seeing that shift. We are keeping these patients local. We're able to perform Zeto. We're able to get the reads back from our teleneurology and timely reads. So it really, in broad strokes, it helps avoid sending patients unnecessarily out of your hospital, or determines when it is appropriate to send and say, yes, get to tertiary care. This patient's actively seizing.
Gotcha. What a valuable tool. And I know as a bedside nurse, that just feels so empowering. It's hard to ship patients out, especially when you don't know what's going on. But to be able to say, okay, we've done the test. We know with confidence this patient needs to go. Or we know with confidence we can manage this right here. And their family can come visit them right at the bedside. And they can be, in their own community. Like that is so beautiful. Those are the things about nursing, about healthcare as a whole, that we don't really see shown on like TV shows. It's all like the big dramatic events, but I think it's the beautiful aspects of what's actually happening at the bedside. The family gets to come be with the patient. That's the stuff that really draws me personally to nursing. I wanted to just get a little bit more granular here. If you could back up to whenever you first made the decision, okay, we're going to bring on Zeto, we're going to have this technology in our hospital. Is there anything that you learned about introducing a new technology, maybe that you would share with another nurse leader? Like how did you make the pitch to bring this on? Anything you learned about the implementation process, about getting buy-in, anything that you would share, words of wisdom? Because I'm sure there's other nurses that are listening like, oh my gosh, I work in a rural facility and I want to have Zeto at my hospital. How can I advocate for this? How are you successful in bringing this into your facility?
Yeah, that is the part about being a nurse leader and a passionate nurse leader. I'm so passionate about this, is that you have to figure out what your organizational goals are. You have to be in step with your administration and your medical directors. You have to understand what the vision of your hospital is. And in addition to that, right, for us, for my hospital, keeping patients close to home, that is the strategy. That is the vision, right? And so as a nurse leader, I sit back and I say, how can I impact that? Like, what is my role in the organization to help get there? So that's one thing that I'm sort of like thinking over here. And then the other is what is my connection and my collaboration and my partnership with my medical director? How do I draw on the intensivist sort of understanding on how to run an ICU program? How do I draw on that? And when they say, hey, evidence-based, the standard of care, the direction for rural medicine is this, right? These tools, this innovation. So you're drawing on that. You're drawing on, your leader, your organizational, your system level sort of drivers. And then you're the catalyst. Nurse leaders are the catalyst for driving the mission of your organization. So I would empower nurse leaders to say, what can I do to impact the patient experience? And go out there, become involved, be a part of, in my case, the Society of Critical Care Medicine, or for ER Nurses, Emergency Nurses Association. Figure out where the trends are going and be that advocate. Go to your C-suite and really drive home what you can do for your patients and just advocate. Be that person.
I love it. I think as a nurse, We always think that our role is to administer the medicine, to do the dressing change, all these like technical skills, but so much of what we're doing is actually advocating. Like the things that might impact our patient might be a phone call we make in the hallway when I've been touching the patient. And as a nurse leader, you are impacting so many patients' lives by the advocacy that you're doing, like you said, in the C-suite, pushing for bringing new products on, pushing for change in staffing ratios, pushing for process changes. Like, I know it's hard to like envision, but you impact even more lives as a nurse leader by doing those things, that very important work in an office somewhere, in a boardroom meeting, advocating for the patient that's in a bed in your own hospital. So I just wanted to point that out, give you some kudos on that one.
Yeah.
Well, Kristen, I feel like you wrapped everything up that I would have wanted to talk about. Is there any reflections you have looking back? Like you implemented this how long ago, the Zeto technology?
We've had it over a year, just over a year.
So about a year ago.
Mm-hmm.
Anything looking back for the past year, how would you feel like this has impacted maybe the culture of your hospital or the care you provided? Just overall, what's your biggest takeaway since you implemented this?
There are so many takeaways here, Sarah, but the initial, like my sort of hook for this was in the ER, when I was a nurse leader in the ER, seeing the strain that it put on families to transfer somebody out, right? I would have people come up and say, I don't have a car to get to X hospital. I don't have money, gas, means to go and visit my family member or be there for my family member an hour or two away, right? I've known that. I've experienced that for 15 years as an ER nurse. And it was so deep and it was so needed at the time to figure out how to provide care close to home that the only thing that I can say in reflection is like, I wish we would have done this sooner. I wish that I would have been able to have the knowledge and the wherewithal to say, how about we do this, but years ago or whatever it was. So that's a reflection for me. However, the other opportunities that this has brought is when we rolled this out, it was actually pretty cool. We cast the message widely that this is a service that we're going to be doing at our hospital. And I had outpatient physicians from the community emailing me and being like, hey, can we do this on the outpatient setting? Like how do I get one of these EEGs, from family medicine physicians in the community? And I'm like, this is it. Like, this is how we become sustainable is I say, okay, what does it take to do outpatient EEGs? How can I utilize this tool in the inpatient and the outpatient setting, right? So all of that together over the last year, I would say, or last several years, all of that together helps you go back and advocate for growth and development of a program. And I would just say that it's been so good. It's been so good. And I'm so happy with our success. And it's great when I go in and I round on our ICU patients and I see their families at the bedside and they've got the Zeto on and we're performing the test. And I'm able to sort of talk to the families and, explain like, this is something that we're doing to help your family member. And this is what we're looking at. And it's very special. And so I don't know what more to say, except for I'm just so happy we took the jump into this.
That's awesome. Well, Kristen, thank you so much for sharing your story and for the incredible work that you and your team are doing to deliver this high quality care right in your community. So if any of you are listening and would like to learn more about this Zeto technology, one, you should just Google it because it looks so cool. But I will also put a link in the show notes for you if you want to check it out more. It really does help you deliver the best care at your facility. So thank you for tuning in today. I hope you are inspired hearing about the work that Kristen is doing. You got a little behind the curtain look at the role of nurse leaders, like what they're doing to advocate for their community. This is a really great episode that highlights the power of nurse leadership and innovation, how the right tools, smaller hospitals can still offer exceptional care and keep patients where they belong, which is close to home and close to their family. This is the heart of nursing that we all signed up for. So, Kristen, thank you so much for your time today. Have a good one.
Thank you so much.
Before you go, I have an exciting announcement. You can now earn CEs for listening to this podcast. That's right. Our Renegade has teamed up with podcast hosts like me who are delivering amazing content that not only educates, but inspires you to be the best for your patients. You get to learn and earn continuing education credits while absorbing knowledge from thought leaders and innovators in the field of health and medicine. You're already listening to podcasts during your commute, at the gym, or while unwinding after a long day. So why not earn your CEs at the same time? And that's where pod classes come in. Yep, it's just what it sounds like. It's CE learning through podcast. To learn more, I put a link in the show notes for you. Well, thanks for listening. I hope you learned something that will save a life. Remember, nursing is a team sport, so trust your intuition and don't give up advocating until you are confident you've done what's right by your patient. The views and opinions expressed on this show are that of Sarah Lorenzini's. That's me and mine alone. They are not intended as medical advice and should not take the place of your institution's policies or procedures. Evidence-based practice is ever-changing, and your patient care should reflect the current best practice. So if you want to get in contact with me, you can shoot me an email at sarah@rapidresponsern.com or on all social media platforms as the Rapid Response RN.